Welcome back. We are answering your questions about the coronavirus with Cone Health's Chief Physician Executive, Dr. Bruce Swords. Remember, you can text your questions. The number's right down there, 336-379-5775. All right, Dr. Swords, let's talk about the protests and the races that happened over the weekend. There were people at all of those events. What happens now? What should we be looking for if we are part of the community? What should we be looking for if we were at one of those events?
Yeah, those events certainly are capable of spreading coronavirus quickly and widely. So again, the closer you are in contact with people for prolonged periods of time, those are the risks of spreading coronavirus and COVID-19. You asked the question, what can you do now? So now, again, would be a time to, if you were at one of those events and you've got the capability of staying away from family or friends because you might have it and might not know it, that would be a great thing to do. If you're going to be out, please wear a mask. It might be the most important thing that you can do when you're in public, because you wearing a mask prevents you from spreading the illness. And of course, I'd be a big advocate if you're at a race or at a protest, wear a mask as well.
A follow-up question to that. If you were at one of those events, Dr. Mandy Cohen had said you should go get tested. If you go get tested now, will it show that you are positive or negative, even though the symptoms don't usually come for another 2 weeks?
Testing of coronavirus, COVID-19, is an interesting science in and of itself. Generally speaking, we don't think that people will get sick for 3 days, maybe 5 days, maybe 14 days after they're exposed to the coronavirus. So there really isn't a reason to get tested until you start having symptoms from a personal point of view. From an epidemiologic point of view, it might be really interesting to test everybody who went to a race or everybody who participated in a protest 3, 5, 14 days after the event. Right now, the state and most health systems don't have the capacity of testing that volume of potentially exposed people.
So this is another follow-up to that question. Dr. Mandy Cohen had said the health metrics are headed in the wrong direction. We heard that just about 3 o'clock this afternoon. What is your reaction to hearing that now that we are 2 weeks into phase 2?
Yeah, the definition of the wrong direction is interesting. And so we have seen the number of cases of coronavirus increase in North Carolina. Some of that is very likely due to increased testing and therefore increased identification of people who really aren't sick enough to be in the hospital. So that's one of the metrics. A metric of how many hospitalized patients there are and how many are in the intensive care unit would also be metrics we should be following. And that data is harder to come by. At Cone Health, the number of hospitalized patients has really been pretty consistent over the past 3 weeks or so.
This question is asking, I'm concerned a family member of mine who recovered from COVID could get it again. Is that possible?
We're learning an awful lot every day that we live through this coronavirus. And so the real answer is we don't completely know. The expectations are that once somebody has been exposed to the coronavirus, this COVID-19, they should be immune and won't be able to get it again. We may learn differently as time goes by.
Yes, this is something that just because you say something at one point doesn't mean you're not going to find something else out again, and we need to change and regroup and all of that. This person is asking, how long does a person remain asymptomatic with COVID-19, and does it eventually go away?
So I'll reiterate a little bit of what I said, and that is when someone's exposed to the disease and catches coronavirus, they will be asymptomatic for a period of time, meaning they won't have symptoms. Somewhere around 3 to 7 days, they're most likely to get symptoms if they're going to get symptoms. And sometimes the onset of symptoms will be delayed up until 14 days. So somewhere between 3 and 14 days, if folks are going to get symptoms, they will get them. There also is this concept of asymptomatic carriers. So people who carry the illness, carry the virus, are able to spread it, and absolutely don't have any symptoms at all. I'll change topics to the question of, do you get over it? The thinking now is, yes, people get over coronavirus and are able to get back to their normal lives. We think that happens most of the time. Again, we may learn things down the road that we don't know now, and we do know that most people, at least acutely, recover from coronavirus.
This person is asking about masks. How often should I clean the cloth masks that I have?
So first of all, thanks for wearing the mask. I think it's one of the most important things that you can do out in public. And from a washing mask point of view, I would just make a habit of washing them every day. If you have a cloth mask, wash it every day.
And then there is a question, how concerned should we be about a second big wave of coronavirus? And I know that you've handled this before. You said you're not looking for a wave, you're looking at a plateau.
That's right. So today, I've said for the past few weeks in our hospitals, we've had roughly 50 to 65 patients in our hospitals with coronavirus, and that's been reasonably steady. And we think our modeling suggests that we'll have about the same number of patients for a prolonged period of time. What happens in the fall or early winter, there's expectations that maybe we'll see more of coronavirus. We don't know that. We're hopeful that the whole country will be more prepared for increased numbers if that were to happen.
We are having a few text questions about the same subject. It's about visitor restrictions. It says, I saw that Novant and Baptist have or will be tweaking their visitor restrictions. Any idea if and when Cone Health will be doing the same?
Yeah, since the beginning of our response to coronavirus, we have made several changes to our visitor restrictions, really for patient, staff, and visitor safety. And we continue to change, improve our visitor restriction policies. I don't know how many times we've changed our policy, but it's many, and we will change that again. We do think over the next short period of time, I don't know exactly when, that we'll loosen visitor restrictions, but we will absolutely do it in a way that keeps patients, staff, and visitors safe from coronavirus.
And of course, as soon as that happens, we will have it on our website. We will be able to tell you all of that as well.